Okay, it's Dr. Buford. We're just going to start on the right shoulder. We're looking in from the back to the front. We've got our two cannulas coming through a part of the shoulder called the rotator interval. This blue one is what we call a dry dot cannula. You can see it's got ridges on it to help it stay in place. And you're laying on your side, so your arm is up in the air in the shoulder holder. So this rounded surface is actually the humeral head. This is the long head of the biceps tendon right here. This is the biceps anchor. This is the area where if you're going to have what we call a slap lesion, this is where you would have it. Fortunately, you do not have a slap lesion. That looks great. Your rotator cuff is right up here at the top of the screen. Got a little air bubble there, but here you can see the undersurface of the rotator cuff. That looks good. And so what we're going to do now is put the camera in the front. There's a little bit of what we call a Hill-Sachs lesion. This is what happens to the humeral head when the back edge of the humeral head dislocates over the front edge of the glenoid. So this is our Bankart lesion. There's different severities of it. The labrum here still looks pretty robust, but you can see how this is loose. And so this is what we call a Bankart injury. So we're going to put some anchors in ultimately right along this line so we can secure this back to the bone, okay? You can see after all this time, this is as good as it's going to get, I think. It's just not going to heal any better than that, and obviously this is not good enough because you're still having instability. Okay, so now we're looking from the front to the back. The Bankart injury in the front is going to be right here. We're going to look at the back first because most commonly we take a rasp and we roughen up the back of the shoulder just so we can really tighten up this inferior glenohumeral ligament. So in a second here, you'll see the rasp come in. And this is where we'd like to place an anchor. You can let go of the shoulder. Yeah, place an anchor to tighten things up a bit. This is the posterior band of the inferior glenohumeral ligament that we're looking at here. And you can see it doesn't have a lot of tension on it there. I think we can make that a little bit better, and it'll give us a stronger repair. So we'll keep working here, show you some more in a little bit. Okay, so here's our finished stitch in the back. That looks good. That's tightening up that ligament right there. Okay, and now we're going to do the rest of our work in the front. So we're going to take that liberator, black handle, and we'll show you the Bankart lesion because one of the things we have to do is just roughen up the edges a little bit. So now gently pull up and back. That's great. And so this is the area that we're talking about. And as we look from the front, we can see right down the anterior aspect of the bone, of the glenoid here. And so we're just roughening this up. It's been trying to scar down for years, really, so we want to just release some of that so we can put this back in an anatomic position. This is arguably the most important part of the procedure, actually. Everything's important, but we want to make sure that we can release this first so we can reposition it. And that's just what we're slowly doing here, okay? We'll work all the way down inferiorly here. Okay, we'll show you some more in a little bit. Okay, so one of the questions I often get when we're teaching is how do you know when to stop doing the release? And this is a good demonstration of how we know when to stop. When the labrum is floating back up in an anatomic position without any pressure on it, you can stop. And so remember before when we started, it was basically like this. Now that we've freed it up, see how it lifts up and we can sit it right here, and that ought to be a nice repair for you. So I'm really happy with the way that looks. The next step is to take a guide, which you'll see come in here. I like these curved flexible guides because they allow me to position the anchor in a good spot, and it aims away from the edge of the socket so we know it's not going to perforate. That looks pretty good right there. We used to have to go a little bit farther onto the glenoid face because the anchors were bigger, but now that the anchors are smaller, we can basically get right on the edge of the glenoid. And so there's a little guide wire coming through. Functions as a drill there. Just hold still right there. And next we'll place our suture anchor, which is made out of suture material itself. Now we'll back it out, and there's our two sutures. We pull tight to seat the anchor. That's very snug. We're going to take a crochet hook. We're going to pull one of the sutures out of the back here. We'll put a grasper in the back, and then we're going to do our suturing in the front. Turn to the right. Okay, so here's our turn to the right suture hook. And the way that we judge our stitch is we put the tip where we'd like it to come out right there. And then we rotate back, and we do a little bit of a shift by going a little bit more inferior. And that's where we first go into the capsule. You can see that stitch there. And then we pull back